All right, thank you very much for tuning in. We're talking about the Clare Health Centre in Clare, Digby County, Nova Scotia, but there's some all over the province. If you're watching from anywhere in Nova Scotia or anywhere in Canada, you know that MAID, well, it's the law. Is it really the law? Well, what is it really? It's just decriminalization of it, right? You're not going to get put in jail if you kill somebody. That's basically what's going on. So it's not actually the law as it stands. It's just this bill was tabled to not criminalize the act of murder. Right? Basically, that's what's going on here. So, but whatever. The Clare Health Centre, right? So we got to pay our taxes to do what? Well, we're going to kill babies, right? And we're going to kill old people, right? So these are the most vulnerable, voiceless members of our society. So I did I actually wrote a whole book about the abortion thing, and you can check that out on my other YouTube channel. And the medical assistance in dying is what we're talking about here in this YouTube channel. So, I'm not really talking about if you're pro MAID or against MAID. I don't really care about that. The only thing I care about is how this person here, the medical director, Mrs. Michelle Dow, I would not, call her doctor because she's clearly violating her Hippocratic oath and violates medical ethics on a daily basis. But anyway, Mrs. Michelle Dow, the medical director at this place that does not, and don't get me wrong, this is a very this argument does have lots and lots of merit. Does not use an anesthesiologist for the MAID procedure, right? This is certainly, but why? All right, why? When it comes to how MAID is administered, particularly without anesthesiologists, there's a growing concern that some health centers, like the one in Clare or others across Canada, might be following a policy crafted more for cost efficiency than for patient safety or ethics. MAID policies at many institutions do not require the involvement of an anesthesiologist, despite the fact that the drugs used can cause intense pain if administered incorrectly. There's a real risk the patient may remain conscious but paralyzed. Imagine that you're paralyzed, you can't move, you can't scream, and it's so very, very painful. All you want it is to stop. You want it to stop. You want it to stop, but it's so incredibly painful, and then you die. I mean, that's certainly not dying with dignity. Paralyzed, conscious but paralyzed, and this is certainly a legitimate argument that I'm putting forward. It's not a joke. I mean, this is a real. This argument surely does have merit. Anesthesiologists are the only specialists trained to ensure sedation, unconsciousness, and pain relief during such procedures. So why wouldn't they be required? So the uncomfortable answer is likely budget. Hiring an anesthesiologist for every MAID case costs more. And when cost cutting becomes the priority, ethics and patient dignity can take a back seat. If a hospital policy allows nurses or general physicians who lack deep training in airway control, sedation, and rapid intervention to administer these drugs without backup, it's arguably a failure in ethical policy making. The Clare Health Centre may be technically complying with provincial guidelines, but if those guidelines are written with finances in mind rather than patient safety, the real violation is moral. So the bottom line is, if a policy allows people to suffer because hiring the right specialist costs too much, then the policy is broken. But there's no complaints yet. Nobody seems to have complained. So then, everything seems to be going according to plan. There's no complaints. If you didn't see my other YouTube channel, if you do complain to the College of Physicians and Surgeons of Nova Scotia, you are gonna get stonewalled. But anyway, that's the topic for today's video, and I really do appreciate your participation in this discussion. I do believe that this argument is formulated in good faith and has the best interests of the human rights at heart, and we do care for the most vulnerable in our society and all that stuff. Thank you very much for tuning in. We do keep this anonymous because of the woke the woke people that seem to be more interested in canceling free speech and all that stuff. So you know how that goes. But anyway, thank you very much for tuning in. I do bring the most respect to medical science and law, right? And law with this channel. Everywhere I go, everywhere I rest my head at night, and everywhere where I walk my feet in the day, I bring with me the greatest respect for for true medical science and the very, very sacred discipline of the law. And I do believe this argument has merit. So thank you very much for tuning in. I'll see you next time.